Good morning. It's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. All right, I get a couple questions on piriformis syndrome, and a lot of times people are confused between piriformis syndrome and sciatica. So there's similarities because the sciatic nerve actually pierces through the piriformis muscle. So if you have a spasm in the piriformis, you could be having sciatica. And there's differences, but they're kind of closely related. It's kind of somebody has wrist pain, they always consider it to be carpal tunnel. So, understanding sciatic and piriformis syndrome are two different conditions, but they cause similar symptoms. And primarily, big one is pain radiating down the leg, but they do have underlying causes that are different. So, let's go over it. So, sciatic is not a condition itself, but a symptom of an underlying problem. It occurs when the sciatic nerve, which is the longest nerve in the body, gets compressed or irritated. Too much sitting, poor posture, not enough exercise, sedentary lifestyle, accident, trauma. So the most common cause of sciatica is going to be a herniated bulging disc in the lumbar spine, which puts pressure on the sciatic nerve. So it's a little bit further north of the piriformis. The piriformis is in the back part, and if you put your hand in your pocket, you'd probably be touching the piriformis. So sciatica typically starts as pain in the lower back, and it radiates down the butt, thigh, and sometimes even to the calf and foot. Pain can be sharp, shooting, burning, all the other bad stuff, and you might get some tingling, numbness, or weakness in the leg or the foot. It happens. But this case here is maybe an MRI, an X-ray. X-ray is not going to show a herniation or bulge. It'll give you the idea if you have one, and you might still need, if treatment doesn't work or the symptoms don't subside, you may actually need to have MRI and another look at it. Being a chiropractor, when I don't see results a certain amount of time, I'm always going to send someone out for an MRI. It's really kind of the way to do things these days. Now, piriformis syndrome, which can also choke on if it's in spasm, tight, it's going to compress the sciatic nerve. So that's where the symptoms come in. They're very similar. So piriformis syndrome occurs when the piriformis muscle, which is deep in the butt, becomes tight or goes into spasm, like I said, and compresses or irritates the sciatic nerve. And so the piriformis muscle itself is the source of the problem rather than the herniated disc. So that's where the differentiation comes off. And just like sciatica, you got pain radiating down the buttocks, legs. And the thing with piriformis syndrome is more localized in the butt and tends to be associated with tenderness in the area of the piriformis muscle. Um, Certainly, chiropractic adjustment can help. We use a little shockwave therapy for treating muscles like that. So it depends what the person has. And the other two with piriformis, the pain can get worse with activities that use the hip. So say you're kickboxing or dancing, a step class. You're on a Peloton and you're standing. That can really, you're using the hips, that can really make a big difference in having it. Um, and the other thing too is the treatment for sciatic and piriformis can involve similar approaches. I mean, yes, rest, ice, heat, stretching, chiropractic, of course, and it's physical therapy too. Let's not diss our physical therapy brethren. So it's your treatment's going to be different. Okay, so if you have a bulging disc or herniated disc in the back, we have to address that. And usually we do that with spinal decompression, something we've been using, Jesus, for a long time, almost 25 years now. And the same thing is true. We have to fix the piriformis, take the tension off, and actually restore better biomechanics to the hips. Okay, and with the bulging disc, pretty much spinal decompression adjustments, and with the piriformis syndrome, it's going to be more the adjustment and some more soft tissue work on the piriformis itself. So if you're experiencing symptoms of sciatica piriformis syndrome, so early haven't finished my coffee yet, you can understand why there's a little bit of a confusion. Pain is pain. You just want it gone. I get it. But understanding where the pain is coming from is probably the most important first step. So if you think you got sciatica, maybe you got piriformis syndrome, you can always give us a call. 203-656-3636. 203-656-3636. Listen, have a great day and continue listening. I hope you find this stuff enjoyable. Thanks very much. Take care.